force field analysis. So there are going to be forces that are going to drive and forces that are going to restrain the implementation of quality improvement of falls. One of the driving forces is ultimately increasing patient safety and security. We want to reduce harm to our patient. We want to reduce the number of days they stay in the hospital, reduce the amount that the patients have to pay, and all of this affects their future outcome, whether they go home or not sometimes. So that's definitely one of the big driving forces. Another one is nurse satisfaction, knowing that there's visual support, knowing that you have someone making visual rounds on your high risk fall patient, so that the nurse can address other pressing matters, knowing that her patient is being well cared for and observed. Also, the patient's family has a sense of security, knowing that their loved one is being assessed thoroughly per shift, and then those assessments are determining additional care. Their family member is being rounded on appropriately. So restraining forces. These implementations will increase nursing charting and increase on our list of tasks to complete. Then this may be faced with some resistance. Also, the stress of a new protocol and the change in the system. So we have our routine down, we go to work, and this just adds a disruption to it. It adds something new that we have to learn. And then the cost of the new system implementation and training might be met with some resistance. So it's going to cost more money to have more hands on deck, and it's going to cost to train the nurses and to bring nurses in and patient care assistants to be trained properly and appropriately, and this may be met with some resistance.